Good evening, everyone. Thank you for joining us this evening. I hope you've all had time to grab a dinner or drink before joining us. We have a very special event tonight. For many of you joining us in the evenings to listen to and discuss technology and investing topics, this is a change of topic as we are coming to Christmas season, a season of caring and giving. We at iSTOX were very committed to give back to the community, and we're very pleased to support the team at Community Chest at a partnership level. At iSTOX, we believe that wealth should be created meaningfully. Therefore, iSTOX and Community Chest came together to provide a formalized avenue for our iSTOX community and our supporters to support honorable causes. I'm very excited and proud to announce the start of a multi-year partnership with Community Chest. And not only are we going to have a ribbon cutting ceremony to kick off this partnership, we also have a fireside chat with Charmaine today, and she will talk to us about starting your giving journey today with Community Chest. Tonight's webinar will be the first of many exciting events held together. As part of our ongoing support for Community Chest, we have also created a special banner on our website where we hope that clients, friends, visitors, our iSTOX community, to help them to donate easily to Community Chest. The funds raised will support causes such as children with special needs, youth at risk, adults with disabilities, and vulnerable seniors. And we're very, very happy to have our VIP speaker today, Charmaine Leung. Charmaine is the Managing Director at Community Chest, Group Director of Fundraising and Engagement Group at National Council of Social Service. As the Group Director of the Fundraising and Engagement Group in the National Council of Social Service and Managing Director of Community Chest, Charmaine is key in steering and growing Community Chest efforts in engaging the community to bring collaborative and sustained positive impact to the social service sector. Without further ado, let us officially kickstart this meaningful partnership with an official ribbon cutting ceremony. So, Charmaine, you have your ribbon ready. All right.
Yes, I do.
Shall we cut this ribbon? 3, 2, 1.
Thank you.
Now, let me hand this over to Charmaine, where she will share with everyone the benefits of donating and helping the less fortunate through Community Chest. Over to you, Charmaine.
Thank you. Thank you, Oi. A very good evening to everyone here. I just want to say how delighted we are to be invited to be on this platform. And also, we're really, really heartened by iSTOX initiative to partner Community Chest to rally the finance community to do good. The social service sector has been especially hard hit by the pandemic. Singaporeans have been very forthcoming with their donations towards COVID-related causes, and we're very, very encouraged by that spirit. However, many social service agencies out there in Singapore are facing a sharp decline in overall in funds for a lot of the critical programs and services that they provide in serving those essential needs. So these could be programs for counseling services for persons with mental health conditions. As we saw a really sharp increase, during this time, this challenging period for that. And also other long-term critical needs, such as children with special needs. The needs in the sector will only become more complex and varied in the future. So it's really, really crucial that some of the programs run, and I'll talk a little bit about them, as I go through the webinar, that, these will continue to receive necessary funding so that the negative impact of the pandemic on these vulnerable groups within our community can be mitigated. As it is, we know that they're already vulnerable, and a pandemic, in times like this will make it much worse for them. Oyi mentioned earlier that at Community Chest, we rally our funds for 5 causes. So you can see here on this slide, we have one purpose, really to raise funds and engage the community. I consider my role really to provide resources to the social service sector. So this could be in terms of being financial resources and also volunteer resources, which we'll talk a bit about later. So the 5 causes we mentioned are children with special needs, youth at risk, adults with disabilities, family in difficulty, vulnerable seniors, and persons with mental health conditions. This is our 37th year. And really, we are here to provide a collaborative and impactful social service ecosystem. We want to be able to build that. We are actually not a charity, what we are is that we are an aggregate fundraiser. We fundraise for charities. So 80 social service agencies that we fundraise for them. They provide about 200 critical services, and 100% goes to the charities. The reason why we can claim that and say that is because we are mainly funded by the tote board. And as a result, of course, we have our operating expenses and all, but that's been paid for by the tote board. Hence, we can say that every dollar you donate goes to the charities. Now, so on the next slide, thank you. So what really Community Chest wants to do is really as a philanthropy partner to our friends out there. I mentioned we provide that gateway so that it is a portfolio of really, more than about 80 charities, social service agencies with the different programs. We are a leader in the social service sector because of our specialized knowledge as being part of the National Council of Social Service. And we provide customized giving volunteering plans. So that's what I talked about bringing resources to the sector, also in terms of volunteering. Because if you have, if we're able to channel regular volunteers into a social service agency, then what they can do is that they probably need to spend less to hire for that particular need that you have fulfilled as a volunteer, and that would also help them to run their services. We also want to invite, as a philanthropy partner, we invite our partners into exclusive networking sessions so that like-minded people, you almost can form that whole circle of giving where you can talk and share, your journey and actually be inspired. It's amazing, the collaborations that come out of that. And last but not least, I think tonight, we want to talk about this, in this platform as well, is that the government is really, really supportive. So there is actually a 250% tax deduction in terms of your giving. And this was announced, in the budget in 2018. It shows how much emphasis the government, puts behind, building that whole giving culture to really provide tax deductions on donations. And it's 250%. As long as your donations is made to a IPC, a charity with IPC status. Right, the next slide, I think I'll just talk a little bit more about the various categories of tax deductions there are. So just for those of you who are interested, for the individuals, it could be your CPF relief, tax savings for, you get all sorts of tax deductions, right? Tax savings for married couples, families, deductions for employees, for investors, a tax deduction scheme into angel investors, for rental expenses, education relief, for self-employed. So there's a whole section, right, in terms of, when you're filling up your tax form, or, now it's the pre-filled one where you can actually choose the different categories. And then there is the deductions on donations. So this is where we were talking to you about that. And also that a personal income tax relief cap of 80,000 applies. So across the board for that year of assessment, it is 80,000 applies to the total amount of all tax relief claim. So there is a certain cap. Right, and in terms of now this is public information. It is out there. Your resident tax rates from 2017 onwards. You can see that of course, as you earn more, your income, your chargeable income becomes higher. Then your tax rate goes all the way up from a low 2% all the way up to 22%. Each of each of the range is about 40% into the next income bracket. And the next slide will show you how, if you're making a donation, how that actually can affect the tax rate you finally pay because of the tax deduction that you get. So for example, if you were earning an employment and an income of about 320,000, there are the columns on the right to show you without donations and with donations, what will it look like? If you made a donation of 32,000, if times 2.5 times, so that's 80,000. So then what happens is, in terms of your employment income, 320,000, you take away 80,000 because that's taken away from your chargeable income, and your chargeable income on taxes will only be 240,000. So that brings you into a different tax bracket, and hence the savings. The difference is about 15,800. So just to say that while you're doing good, the government provides that tax relief, and hence is able to bring your income, the taxes down, and also to help all the charities that I talked to you about earlier. Now then we have a next example to show that if you were donating more than 32,000, so let's say 50,000, again the same formula applies. your amount, your deductible is actually 125,000. But we mentioned that there was this cap. So actually, what will happen is that you still will only be able to do your cap of 80,000, still be chargeable only for your income at 240,000. But the remainder that of that 45,000, the deductible donations, the non-utilized portion, can be carried forward to the following year. And this is limited to 5 years. So without being a tax expert, I'm here trying to give you a few scenarios to talk about how actually doing good also does good for the tax rates. Right, moving on to the next slide. So I said earlier that our tax deduction, our donations actually go directly to empowering lives in terms of the social service agencies we mentioned. So each of these social service agencies could have a different cause, different programs to help the different beneficiaries. And all of that will go to them in terms of donations because our operating cost is mainly covered by the tote board. On the screen, you see our 5 causes. Which is really is about those who have fallen through the gaps. We know that there will always be needs, more needs than resources. And where we are working, in terms of the work that we do at the National Council of Social Service and ComChairs, is really to have the support go towards these 5 causes, but also the most critical of these 5 causes. There will be a lot of different needs, but the most critical ones. Moving into the next slide. So we're hoping then, really at the end of the day, what is our vision is that every person, regardless of, your circumstances, you're empowered to live with dignity in a caring and inclusive society. One of the things that I think it's probably implied, and we don't talk about it so much, is that really it is about empowering everyone so that, I think today we see that there are people who probably don't start as well. We don't start at the same line, especially children, for example. If they are from low-income families, then they may have less tuition. They may not even have gone to preschool. So these things do happen. And what we're doing is that if we actually have donations into programs that actually help young children, then it's actually to have programs to then actually put them at the same starting line, as some of the other children from, conventional, more privileged families. And that way, they have the equal opportunity, at least the equal opportunity to try, to strive. And that's what we mean by every person is empowered to live with dignity, and so we don't leave anybody behind. And moving forward, Community Chairs as your philanthropy partner, what do we offer? Why should people donate to Community Chairs? Because I did say that what we are is really an aggregate fundraiser. We don't fundraise for ourselves, but for all the charities out there. What we try to do is to really have strategic and sustainable giving. How can we do that? We do that because we're able to know, being a National Council of Social Service is actually a membership organization where we have many members who are social service agencies. By donating to the charities, the 80 charities that we picked, which is most critical, we're able then to really have a whole portfolio on and looking at a broader view of looking at what are the needs out there. And for example, if we know that these are the most critical needs, and some of these needs are already been addressed and given to, then we are able to also speak to donors and say, actually, perhaps you want to consider the less served needs. So we can then also balance overserved and underserved needs. We have in our experience seen that donors there's certain causes that appeal to donors, for example, young children and elderly, but persons with disabilities or persons with mental health conditions, because maybe it's not as known, maybe those causes are not as appealing, may not be noticed as much, and hence their needs may not be addressed as well. So that's how we want to be able to work and be able to do that. Then the other point, I think interestingly in the poll, we actually showed that, sorry, just to go back to the previous slide. In the poll, we showed that many people would like the impact reports. And this is actually where I think we are also working on having measurable outcomes due to a strong understanding of the sector. So what we do is that we will actually come up with an impact report to show how the funds have been used for each of the different causes. We have a strong governance in terms of due diligence. We have platforms where giving can be acknowledged. So we do have platforms and ComChairs where we acknowledge and want to pay tribute to, our donors, and not it's not really just to, for them, besides recognition. It's really not so much to show off, but really for them to be out there to inspire other people with their giving. Employee engagement is one area as well, where we know that a lot of employees, if they are volunteering, they feel more engaged. So that's also something that our corporate partners have told us, that this becomes something quite important for them. So that's why we can say that we provide customized giving volunteering plan, the opportunities to volunteer, and also, invites to the networking sessions that I said earlier. Moving on to the next slide. So really, I think as we come to you, in this community, we have worked out a few tiers where, you can customize your giving. And in terms of the various ways you want to be involved. And so there could be starting from volunteering opportunities, if you have, donated a certain amount, and actually it can actually be more and more bespoke as you want to engage more, even into the causes, or actually arranging for volunteer opportunities at the social service agencies that actually serve the causes that you donate to. And of course, the impact report at the end of the financial year, which is something very important, something we take a lot of pride in doing, because it is important to show what your money, what your giving has been, has helped the sector. And we, of course, hope to see those figures grow and help more and more people, every year that we do, so we'll do it better. Right. So moving forward, I would just want to tell you a little bit about the evolving social needs and the trends in the sector in terms of young children and the youth sector. These are some of the figures out here. And that, 76% increase in the number of children diagnosed with developmental issues. There are also more children and youths considering suicide, with, youth suicides, highest in 15 years. So we're seeing some of these trends that are already happening. And how then, can we help the sector? This segment, 30% increase in the number of new youth abusers below the age of 20. We've also seen, I think, during this period in COVID-19 pandemic, when everybody worked from home and people are most, all stuck in an enclosed space, that there is actually more issues, more family issues that we have noticed in the families as well. Next, in terms of trends in persons with mental health sector, 1 in 7 are affected by mental health conditions at some point in their lives. I think this is actually quite a shocking, finding to know that this happens, and especially now, I think, where we're going through very, very tough times during the pandemic, we see a lot of that happening, and a lot of you are not aware. So really, we want to be able to help persons with mental health conditions. 11.1% unemployment rate amongst persons with mental health conditions compared to those without. So we need to bring more information and awareness about persons with mental health conditions, and normalize, that, and to be able to help them to be able to come back to work if they do have mental health conditions, and how do we help them. So programs that we support will do that. The next is trends in elderly and the family sector. We know that Singapore is an aging population. It will continue to grow older. And by 2030, we are going to hit, 83,000. And very, very high numbers of seniors suicides, highest recorded in 2017. And also, the families that are on financial scheme, that's always increasing. So the needs are always, out there. Next is trends in adult with disabilities, disabilities. 1 in 4 with disabilities in Singapore are gainfully employed, so there's still potential to actually, provide more employment for them. And a lot of times it's not about just, it's about giving them an opportunity so that they can provide for themselves. How do we go about in our work, besides donating into these programs and providing the grants for these programs, is to also bring awareness for employers. Part of the work that we do is about public education, to bring awareness to employers so that they will consider maybe do some job redesign to help persons with disabilities. So those are programs that are ongoing, that we support in terms of the donations that come to ComChairs, that will help this sort of awareness building. So really, I think we mentioned a bit just now when we talked about the impact of COVID. We've seen that you read it in the papers, really about more cases of family violence during circuit breaker. More help is being needed. People are calling the police, reaching out for help. Elderly is very hard hit by the social isolation. A lot of us today are pivoting and doing webinars and doing Zoom calls, but think about a lot of seniors who may not even have digital access, for example. So that in itself already puts them at a disadvantage. And yeah, and then the next slide is on really the changing needs and trends. I think today what we are really trying to work towards is to strengthen the Singapore's social safety nets. We want to be able to have a strong fabric to be able to hold the society together. We are unlike some developing or very poor countries. We may not see the poverty or the difficulties right on the streets, because in Singapore, we're very lucky. But actually, the needs have become more complex. There could be intergenerational vicious cycle problems, that's within families and all. So today, I think we are dealing with much more complex needs. And it could be, that there's quite a bit of comorbidity in it, and it's not just one problem that a family is dealing with. So that's where we're seeing that the social service sector needs a lot of help. It's not an isolated need in any one time. So really, the ways that the community out there, when we speak to community and individuals and organizations, that are listening in today, the ways that you can make a difference is, of course, by donating. There's outright donations. There is our monthly program. It's called Share. So really, regardless of how much you donate, whether it's $3 or $50 or even $100, up to $1,000, we do have people that actually on a monthly basis do that donation as well. So that helps to help us to build up a very good base where we then can also provide for all the programs that I talked about. You can fundraise as a company event. You can do charity galas. I think this year it's been a lot harder. We used to have lots of golf tournaments and all that events. So this year we also have to really pivot and change the way we do fundraising. A lot more has gone online, digital fundraising, and we've seen some success with that as well. So fundraise is one method. The other one is to enable, whether be it by sponsorship, the talent or expertise to provide that. So that some form of providing talent and expertise can be seen as some form of volunteerism as well. Outreach platforms, so platforms like that. So thank you very much, iSTOX, for actually providing us with a platform like that, so that we can have the ability to reach out to a different community. And one of the vision, I mean, really, that we have, and I have, is that how can we really infuse, the different facets of life with giving opportunities. I think we're all very used to talking about outright donations. We get it from the corporates, from the individual. But sometimes it's also about doing good while you are shopping. For example, if we can actually get shopping malls, to say, well, how about rounding up, when you are paying, just the shillings at the back. And that all can add up. So it's really about the power of the collective. And we've seen that so much in this pandemic season, where everyone, reached out, and every dollar matters. So there's also volunteerism, where it's regular, what we call service-based volunteerism, meaning that, as an organization, it's much easier. If you're an individual, you might say, oh, I don't want to go to, show up for this thing I sign up, but if you are an organization, if someone can't do it, you've committed to it, then, you can roster that. So that helps as well. So that's also how, as an organization, an organized group, even if it's an interest group, can help. And this is where I think what we mean by holistic caring and giving is sustained if we do all of that. So last but not least, I think it's a call out really to start your giving journey with us today. We want to be there to be your one-stop philanthropy partner. And I'm going to just end off this sharing with a quote, that greatness is measured not by what we have, but really by what we share. And this is something that is, is a quote from our founder of Community Chest, Dr. Ee Peng Liang. So that's my sharing. I hope that's given you a bit more information about ComChest. And I know there's a Q&A session after this, so feel free to ask me, any burning questions you have. Thank you.
Thank you very much. I mean, that was very interesting. I think a lot of us sort of are in the rat race, and we kind of have our head buried in the sand a little bit, right? So we don't really sort of spend the time to think about others and what they need. But certainly with COVID and what's happening, I think a lot of the social issues are being brought to the forefront. So we'll very now move on to Q&A. I know we have a long list of questions, and we'll sort of try and keep you within time. Um, but I have actually a number of questions, and I'll kick off with the first one. Charmaine, what's happening with COVID-19 this and the pandemic? How is Comchess thinking about the allocation of resource, right? I mean, where do you think are the biggest gaps today that you're fundraising for? And the second question is, you talked a little bit about how your fundraising tactics have to change during this time. How have they changed, and how do you think the community could be more, or how different ways and mechanisms of fundraising could be more helpful here?
Right. So maybe just to answer the first question, I think in terms of where the gaps are, I think the gaps remain the same, and then it's become intensified and more. Really, it's about the five causes. Like I said, how Comchess works, and what we do is that we fundraise for the most critical needs. So there is a certain 80 charities and 200 programs that we've committed to year on year, to continue to give and give out, and that's roughly in the region of about 50 million per year. Even with or without COVID, that 50 million has to be given out. So this year, what we've seen is that many people have given to COVID causes, which is also why we're calling out to say that when organization individuals, if they have given to COVID causes, then what happens is that they may not give to the usual programs, and we will still have to fulfill, because otherwise these programs will collapse. These social service agency will collapse. If one agency was going to be helping 500 families, for example, then one of them collapsing will actually cause, not having that program will actually cause hardship to 500 families. And so I think this is where we find that beyond COVID, while we all have rallied and we're very, very heartened and fortunate to have so much support for the COVID causes, related causes, but be it for the migrant workers or food that we talk about distribution and all in the very early days. I think where we are seeing the need is that it's sustained. It still needs to get back into all these programs in order to help those causes that we talk about. So that's really important. Yeah. And sorry, I have to remember your second question.
How are you changing sort of fundraising, and what is the most effective fundraising method for you now?
Well, so far I think we've found that really to call it digital fundraising. We have our hits and misses. I mean, I have to admit that right from the beginning, when we first started, we were measuring our own KPI. So that there are projects that have gone on digital, and they call out in whether it's Instagram, especially if we have certain help from celebrities. So for example, this year, in about April, the time of April, where Dinosaur and a group of friends actually helped to rally. We managed to, in 3 weeks, we managed to hit the target way beyond the modest target that they actually initially wanted to fundraise. So it was what, more than 300,000 in 3 weeks, and that was excellent. But then that there could be other digital fundraising, if we don't have enough of that call out, and if it doesn't spread beyond a certain outreach, then it's not so successful. So I think we learn, and a few months, we've come a long way. I think we have a lot of methods, try and error, and we learned that that there needs to be certain elements. It would be great to speak to communities where then you can pass on the messages as well, and also to make it easy and accessible. It doesn't have to be difficult. I think we want to also pass on the message that fundraising or donating, doing good doesn't have to mean that you've arrived and you've become really rich. It can be in small amounts as well. Yeah.
Yeah, I remember one of the lunches we had, and one of the participants said, it's actually about the sharing, right? And so it's not. I think we shouldn't think of it as just one off, and then everybody's happy. In reality, the needs are always growing. And I think we all have a social responsibility to support that. If I could ask you, what would be, again, we're all drowned out in a lot of social media and a lot of noise today. What do you think are some of the key messages that resound, that really sort of tug a bit at the heartstrings of donors to support ComChest or charities in general?
I think impact for sure. So really sometimes it's about saying, when you donate $50, what will you help? I think that puts it into a very, very real space. Like, if you donate $50, then you are actually helping a family, or providing for children that has programs after school, for example. But very specific statements like that. That helps, because I think it crystallizes for people what it is that their money is helping. We also must be accountable and responsible to tell our donors, where the money has gone. So having that that impact report or bite-sized information to really communicate where the money has gone is really important. I think we saw that in the poll already. Um, and the other thing, I think, maybe from a corporate perspective, organizations then really is to give them the platform to be able to engage their employees. Because I think today we're in a very different world. I think the working population is no longer about just, of course, the promotions and the salaries are important, but it's also about what the company stand for. And people are, I think today, especially the millennials and all that, really it's about the social purpose. People are very, very aware of the causes, that they want to support, causes that resonate with them. So being able to tell a good story, to actually tell it from a perspective that people can empathize with, is also important.
Thank you, Charmaine. Well, one question for you is from our audience is: do you see some changing trends in the way people donate? I mean, are people giving more because of COVID-19, or do you think everyone's sort of switching the way they give, sort of from one-off to regular plans, and where would you personally like to see this shift?
Yeah, I think since the outbreak of the COVID-19 pandemic, people have been giving towards those related causes for sure, because it's really like the headline cause. And we've seen that. And in terms of giving habits, we're seeing a shift towards one-off donation rather than regular giving over the past 5 years. I think it's a trend that we're seeing. Like what I mentioned earlier, the needs are there year on year. I've given those figures that we need to really give out 50 million, to the social service agencies. And so having a regular giving habit would really, really help with the social service needs. We would like to really, communicate, to people out there to say that, think about giving regularly, rather than just one-off. I mean, one-off big sums are great, of course, but really giving regularly is where I think it also builds up that whole giving culture. At the end of the day, I think it's not just about how much you give, but really about building that culture where we can pass it down to generations. We've met with donors who says that they want to be able to inculcate those values, to the younger generation as well, and they want to do that from young. So it's almost like just a giving plan, right? Like how when we were young, and you just start off with a simple POSB giving plan, and then that's how it starts. So it's with the idea that giving can be very, very simple. It's everyday life, so it becomes a way of living.
Well, I mean, the problem, I mean, we talked about the 50 million, but you have 80 social service agencies, right? How do you prioritize that? And I suppose with some donors, maybe they haven't been potential donors, maybe they haven't been following ComChest so closely, but I know you do quite a lot of thinking and reporting around impact. The second question sort of there is how it sometimes may feel opaque to a donor as to how the allocations are done, and also perhaps the cost of running ComChest. You mentioned the total board. Could you share a bit more with us?
Yeah, so in terms of prioritization, we mentioned earlier that we will look at the most critical needs. Of course, even within the 5 causes that we shared, there'll be some causes, some programs that are more critical than others. So we have in turn a committee we call it Services Committee that is actually under National Council of Social Service, where they will deliberate over, which are the causes that is identified, by our team of staff, our team of staff who goes out and really put their, ears to really what's happening on the ground, and to understand what the needs are, and then bring that back, put it up as causes that we want to support. So it is not done by one person. It's done by a committee where we identify what these are. So these then form what I mentioned earlier, that 200 programs, within that 80 charities. And once we're committed to that, then for that year, we will be given to all of these 200 programs in that 80 charities. We also make a specific point of ring fencing about 2 million of that 50 million to give to under what we call a charity support fund, to give to smaller agencies, social service agencies, so that we make sure that it's not just agencies that are very capable of doing strong programs that will benefit. We are also very stringent in terms of the needs that we help. So it would be social service agencies that have less than 2 years of reserves. We want to make sure that the money is not put, not given to agencies where they have more than enough to last them, to bring them through the year. So those are some of the criteria that we have. They must be IPC. The services that they offer to the what we call the service users, the beneficiaries, have to have an impact. It has to have a actual benefit, to bettering the lives of the vulnerable. So these are all criteria that form parameters for us to assess which other programs will help. And you're absolutely right that it's a very, very hard task to do because there's so many needs out there.
Yeah, and I guess that's that is one of the biggest advantages of donating through community chest, right? Which is that first of all, obviously, everyone might have a specific cause that they are very passionate about, but in reality, community chest, there's so much more than that. I mean, there's a lot of clearly what is needs analysis. Who might benefit more from it. Obviously, some of the causes are bigger and have a better fundraising infrastructure by itself than the smaller ones, and therefore sort of working with community or donating through community chest actually gets the money where it is really, really needed. And I think that's a very important point to make to our audience here.
Yeah, indeed. So it is donating into a pot where we will then put it to where it's most needed amongst that 200 programs, 80 charities that already has been through a set of criteria by a committee. And in that way, I think what we want to also help donors is that they don't have to agonize, which is more critical, because once a certain program has gotten the funding already, then we'll know that if it only needs 200,000 and someone wants to give another 100,000 to that, then we'll say actually the next most critical need, this is already fulfilled. We should really be channeling your 100,000 to somewhere else rather than sitting with this program. And this is one thing that I think we're able to do because we are that aggregate fundraiser. If people were donating to just one charity, then you don't have the benefit of that broader, for the lack of a better word, that portfolio of needs.
And the next question was around cost of running community chest. You mentioned tote board. How does that work in terms of the government support and all that?
Right. So our fundraising and operating costs I mentioned was mainly covered by Tote Board. So Tote Board actually channels the gaming revenue from Singapore Pools and the Singapore Turf Club together with collection of casino entry at levy to support worthy causes that we, that Community Chest is committed to support. Yeah, so this could be, in the form of, so it really is the whole Tote Board group, really. And when we say that, then it's really all the different agencies under Tote Board that collects gaming revenue in that sense, to be able to help us.
Great. What are so there've been 2 or 3 questions around how, besides sort of donating money, what are the other ways that our audience can volunteer to support a community chest?
Yeah, so definitely volunteering is something that we talked about. I mentioned earlier also, that is another way of bringing resources to the sector. And besides the, when people think of volunteering, they say, oh, I can go one time, and then maybe at an event they can be exposed to it. But what we hope to build is actually a regular supply of volunteers. When I'll give an example, if Assisi's Hospice, there may be a lot of duties in there that require medical knowledge, the nurse duties and all. But if it's really just to actually sitting there and befriending and providing comfort, to patients who otherwise would be alone. If we have regular volunteers doing that, providing that, then the nurses don't have to do that, and they can be deployed to do something else, for example. So in that way, you're actually also bringing resources to that, to the social service agency. You're helping them to cut down their manpower costs that they otherwise would probably need to hire. So that in a way, we may not be donating cash, but the volunteering really helps. So that then it could be befriending services with elderly, with seniors, or even participating in programs with youth at risk, for example, keeping them meaningfully engaged.
Great. I think we have time for probably one or two more questions. Well, actually, so for the volunteers, do they go onto the Comchest website or do they go directly to the charities? What's the recommendation?
Right. So if it's, I think if we're looking for volunteering opportunities, we actually work very closely. In fact, we are part of the SG Cares movement, where if you actually have an SG Cares app, that's where you will find many volunteering opportunities, to at least test that out. If you are an organization looking to bring your team of, hundreds of people, and do want to roster and do that, then do give us a call. I think that needs a bit more engagement, or a bit more organization, and we can also then be able to match, the organizations, the agencies that need, help from organizations.
Great. I think we're coming to the end of the evening. One last question for you, Charmaine. What are some of the exciting sort of events that Comchest has in plan, given phase 3 is coming?
Right, so it has been a very exciting, yet challenging year in terms of the way we've been doing our events. Many fundraising events couldn't go as per normal. We managed to do a couple, but we did whether it's a fully virtual or it's become a hybrid model. One of those one of the events that do look out for it that's coming up will be we're actually doing a heartstrings walk, which traditionally we bring together about 8,000 people, to walk around, to do a fun walk around the Marina Bay area. That we can't do. We still can't do in phase 3. But what we'll do is that in February we will launch that. So this year the actual event will happen on the 28th of February. But in just in the beginning of February, we will already launch something where people can do it at their own time. They don't need to walk around the Marina Bay area. We've pivoted to do it a bit differently, so you can actually rally. As a company, you can register your employees to do that, and you can do it as like a team building bonding event, just 5 people. Together with we have to comply to the safe distancing rules and all that. You can do it at your own time, and the registration comes with a fee. So that part of what you pay as the fee will become donations that we will be able to bring it to the charities. So that's something to look out for. And we're trying to make it work for everybody. You can do it at your own time. So people overseas who can't come back to Singapore can also support this, and they can all tally up, to clock the kilometers that you've covered. Or you can actually choose to do it around the Marina Bay area, and in groups of 5. So that's one thing that's coming up that we hope to continue. We can't bring together 8,000 people, but we'll do what we can.
Yeah, we have a team that regularly runs around that, so I'm quite sure we'll form a couple of teams there to support you.
That's great. Yeah. So we'll give you more information on that. It's about to be announced. We're just putting the final details together. Yeah.
All right, I think we're coming to the end of the evening. I would like to thank you very much, Charmaine, for the partnership as well as the opportunity for you to share with us today. I really, really sort of think we don't think hard enough about giving back, and I think it's actually all our social responsibility to either support but through volunteering or through some kind of a donation plan with Community Chest. And so I think there's a great opportunity for us to work with you.
Thank
Thank you
you.
so much.
Yeah, thank you, Oi, and thank you, iSTOX, for this opportunity. And thank you to all of you out there who's listening tonight, who's dialed in. Thank you for your time. And yeah, so we really hope that you will think about donating and also helping us in terms of helping the whole social service sector and the social needs in Singapore. Thank you very much.
Thank you, everyone, and good evening.
Good evening.